Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, micturition, the science of urine expulsion. My dharma, the impeccable wisdom, the wisdom of the divine nature. My greatest discovery, Divyank, the divine design of nature, with which the perfect objects are designed and created. Divyank is the reward of 60 years of integrated knowledge. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. We have been talking of urinary system, formation of urine, concentration of urine, and now we are going to talk about expulsion of urine. Now, whatever is formed in the kidneys is brought by ureter to urinary bladder, and the structure of urinary bladder and its connected parts of expulsion have been shown in this particular picture very clearly. You can see parietal peritoneum coverage, within which is the pelvic and urinary bladder there, and two ureters come to the side and enter, and you can see openings inside which are just below the ureter openings, and then you can also see trigone inside with which the muscles come outside, and the muscles of urinary bladder which play very important roles in expulsion are detrusal muscles, which are right on top are the cap. And then you have internal urethral sphincter you can see as you come out of the bladder. Then you also have external urethral sphincter which controls as expulsion outside, and you can see the urine drop outside. Now this picture has to be understood, and now to facilitate this you have a divine designs of nature of expulsion. There is a voluntary system which we can use it. There is also involuntary system which comes to play a role when urinary bladder reaches an amount which is more than it can be retained. It has got a certain capacity. The capacity in females is much more than males. When it reaches that level or goes beyond that level, even if we want to control it, we cannot control it at that particular system, involuntary system. Our autonomic nervous system comes to play a role. Retention, which was maintained by parasympathetic, sacral parasympathetic to be very precise, and of course the control of higher centers. But expulsion is done by the sympathetic system, and we need to understand that both voluntary retention, voluntary expulsion, involuntary retention, actually connection. Once it is understood, I think we'll understand what is urinary micturition or urine micturition 1 to Z. Let's start the amount of urine in male urinary bladder and female urinary bladder. You can see on the left side you have male. It is shown little more than 400 milliliter is collected in that, but I have also shown catheterization. You can expel out much more from male when you catheterize, because retention of urine is much more in males than you have in females. Now, in female, you can see they can retain urine right up to 500 ml, whereas males are able to little more than 400. You can see the difference. And catheterization, you can see little less, but anyway, we are not going to deal with the catheterization or that process because picture was available, so it was nice to show, to produce what are the kind of changes we have. So I'm sure right up to 400 ml micturition can be held automatically by involuntary system, which is primarily centers on sacral parasympathetic, and expulsion is with sympathetic. Now let's understand the urine flow system, how things actually work within the body. Right on top you can see filling of urinary bladder, which slowly and steadily is getting accumulated. Males little more than 400, and females little more than 500 ml can be retained as such. But when it goes beyond that, then this process of stretch receptors or the reflex action or maturation reflex starts taking place. That is the second thing we are talking about, stimulation of stretch receptors. What do they do? Afferent impulses pass by a pelvic nerve. Now, at this particular juncture, I know very well that we have a spinal cord. You have the posterior part, which is sensory, anterior part, which is motor, and the center is where you see parasympathetic system come to play. Sympathetic is between T1 and L2 14 segments, and that process is according to Devian. And those fibers, which are 28 preganglion fibers, arise from 14 segments of spinal cord, and then they distribute. Sacral parasympathetic is the lower part between S2, S3 and S4, and they fibers originate from lateral horns which are in the middle, not anterior horns or dorsal root ganglion. This is also something which I would like to show to you in the picture so that you remember it for the rest of your life without having any mistake thereafter. So both sympathetic and cranial sacral parasympathetic arise from lateral horns which are in the middle, and those fibers are not found in other than T1 to L2, S2, S3, S4. The rest of things do not have lateral horns. They have only dorsal root ganglion and anterior horn cells. Okay, now stimulus. So afferent pass of pelvic nerves is the down part, which you're going to see it shortly, and then you have sacral segment of spinal cord in which S1 to S5 are there, but sacral parasympathetic fibers come only from S2, S3 and S4 only. Afferent impulses via pelvic nerve is there. See, all these fibers come through the pelvic nerves. Contraction of uterus muscles and relaxation of internal sphincter is the second part which is going to take place. All the nerves, whether it is autonomic or voluntary, pass through efferent impulses by pelvic nerve only. There is a contraction of the detrusal muscles and relaxation of internal capsules. And then as a result, the flow of urine into urethra and stimulation of stretch receptors. As a result, afferent impulses via pelvic nerve, inhibition of pudendal nerve, relaxation of external sphincter, and thereby urine is voided or expulsion is done systematically. So I'm sure very clearly, first, after emptying the urine, urine is formed, gets collected into the bladder, right up to 400 plus in males, 500 plus in females, and when reach that level, when you cannot control it further, this process takes place and expulsion takes place. So I'm sure from this point, the flow chart is systematically clear. So having understood that this is the process, these are the stages which are going to take place, is a very natural, like to any common person who is not scientifically inclined, is good enough. But as someone who is a scientist, want to be a spiritual scientist by and large, would like to understand the concept even better. For the person of such minds, let's take it to the next stage. This is voluntary micturition. Right on top, you can see Pontine Storage Center. There is a center in brain stem, which has got three parts: midbrain, pons, and medulla oblongata. The center for checking how much is the urine in the bladder is checked in the pontine area, not in the medulla oblongata. So you can see right on top, and that has got connection coming down right up to pudendal nerve, you can see. And pudendal nerve has a connection with external urethral sphincter. There's also got a connection with pelvic nerve, which has got a connection with detrusal muscles, and also bladder output to detrusal muscles. So I think this picture is very clear. You literally have three components. One from spinal cord to inhibit distribution so that there's no contraction at all. That is primarily to let urine come to the stage which can be maintained. Second, pelvic nerve is there for detrusor muscles so that when it reaches a particular level, it is able to expel and contract the urine and urine is passed out. And pudendal nerve will see the external sphincter is relaxed and urine can easily pass effortlessly. The three components play a very important role in voluntary micturition because as and when you want to expel it out, it can be done. Many a time when you're leaving home or going for something important and you don't find a place, you can have a voluntary micturition system at will, and this particular system plays very important role. There is storage there which will give you. But as we proceed, we can even expel and go consciously without needing to expel it out on their own. Now, involuntary micturition, which centers the autonomic nervous system. You have a system higher than even pontine into the cerebral system. And that particular system, by and large, is able to coordinate how to go about it, involuntary to voluntary to involuntary to supravoluntary, to maybe superconscious level, which in my opinion, I would not advise anybody to use supernatural power to go beyond because it could have many side effects. But within integrated nature, it's better that we can do it as and when you really need to do it compulsorily. There is a possibility available, and that possibility I'm giving it here. Then the fibers come down to the hypogastric nerve, which is connected with sympathetic system, which is associated fibers from T1 to L2, and one of the nerve which is right at the bottom is a hypogastric nerve, which is responsible for expulsion. So information has come down, we can expel it out. So I think from that angle, it's very clear. For expulsion, it's a sympathetic system through hypogastric nerve, which can expel it out. Right at bottom, you have lumbosacral spine, and then you have parasympathetic nervous system, which comes from S2, S3, S4 lateral horns, and that is responsible for retaining it. Then pelvic nerve contracts the muscles, and of course the somatic pudendal nerve is responsible for expulsion because it relaxes it. So I think the picture in this is little more clearer than what we have shown here, how the autonomic nervous system functions. You have higher centers in the cortex, then you have in pontine area, then you have in this particular part of thorax and lumbar for sympathetic, and S2, S3, S4 for parasympathetic. This system is described. These two pictures or three pictures were taken from internet to show you how others do it. But I am sure even for a technically highly qualified, he is able to understand, but doesn't have a very clear picture. How does it actually functions? For that, I think we need to take it to a level where things are very, very clear. And I, being as a spiritual scientist, with a PhD in neurosciences, the kind of work I've done on our autonomic nervous system, I think I should be in a position to show a picture, simple, planetary, which will keep you remembering the whole product for the rest of your life after studying it even once. And let's see that particular picture which I had designed it myself. Autonomic nervous system has both the component of sympathetic system and parasympathetic. Right on the left side, you can see the anatomy is the cranial parasympathetic nerve. There are 4 cranial nerves out of 12 pairs of cranial nerves, which is first part. Second is the sympathetic nervous system originate from thoracic 1 to thoracic 12. Then L2, the component. And then there are 14 segments. There are 28 pairs of preganglion fibers. Then you have left and right parasympathetic chain of 45 ganglion, and the ratio of input and output is the Divyang. 45 by 28 is that. So that is the beauty of this system. So you can see now the middle picture, T1 to L2, 14 segments, giving the pictures on both the sides of two semi-paravertebral layers of 45 ganglion. And then you can see other nerves which are originating at to go from different parts of the body. Sympathetic system is one which travels along the blood vessels, right from top of the head right up to the feet level. Sympathetic spreads throughout. It is involuntary. Involuntary, it is very quick and very fast because it has to protect us come what may. So reactions of parasympathetic system are much more stronger, wilder, and otherwise we have to be careful that we use it only when it's required. Then you can even see the head and neck, you can see the cardiac plexus, you can even see celiac plexus for digestive system. Then you have superior mesenteric for this system. But right at the bottom you can see fibers from the lower part of the segment go to inferior mesenteric ganglion, which is hypogastric. They supply the organs of bladder for expulsion. So it is also called apana prana. Expulsion is done by the fibers down on the left side for inferior mesenteric ganglion, hypogastric gland, to expulsion of urine. So I'm sure now it's very clear how the stimulus in the brain comes, and from T1 to L2 fibers come to 45. Then lowermost part goes to supply the bladder and the components of external, internal, otherwise to make sure micturition is effectively executed. So I'm sure sympathetic part is much more clearer. You can see it clearly how it supplies the down part. But then on the right hand side you have seen sacral parasympathetic system, which is S2, S3, S4. The three ganglia of the five ganglion from which the fibers arise, and those they go and supply five different organs. We'll not go into detail, but that is how the Divyang is designed. But here we are considering only the nerves which go to the urinary bladder to supply. So I'm sure now very clear that sympathetic comes like that. Then parasympathetic comes from the right side, from the S2, S3, S4, and also involuntary nerves like mesenteric nerves are connected with the motor component and sensory component. But at this juncture, let me also make a super conscious effort. In nervous system, to understand concept very clearly, the first thing which comes to play a role is sensory system. And sensory system is afferent, and all the sensory nerves are associated with the complete nervous system. And they go through the dorsal root ganglion, the information to the posterior, they travel to the brain, and you have ganglion reflex, then intersegmental reflex and suprasegmental reflex and higher controls. I have already explained that earlier, and this particular picture will give you how things are. So from that angle we know how different systems work in the process, and we need to have step-by-step approach to make sure things are done systematically. So sensory component takes the information, how much is the urine present. If it has reached a level, they may not be need unless we want to go ourselves and done with it. But it reaches that level, then involuntary system or micturition reflex comes to play a role, and sympathetic system will throw it out, and to retain it is done by sacral parasympathetic system. And I'm sure now it's very clear. Sensory component gives the information, how is it. When it reaches a level, then corresponding part in the parasympathetic will make sure it is retained to a particular level. When it reaches that level, you have to expel it out, or you can even control it a little more thereafter, which I'm sure many people including me have experimented with a successful result, and expel it out voluntarily as be required as and when time is required. And this was also called apana prana in according to Ayurveda. And I'm just trying to say Kundalini syndrome Apana prana, expulsion of urine, is associated with sympathetic system, and Kundalini syndrome is with the associated system only. I'm thinking, is that clear? Next one. Right at the bottom, Muladhara chakra, Swadhisthana chakra are the two chakras which center around urinary collection of urine, bringing it to the level is required, then expelling it one and large. So Apana Prana by and large is associated with Muladhara and Swadhisthana primarily, sympathetic for expulsion, and sacral parasympathetic for retention, and nervous system otherwise for voluntary expulsion. So I'm sure now it's very clear for everybody how beautiful is nature design, how beautifully centered with Divyank and Divyank ratio, and how effectively it is executed step by step without any problem. From that angle, I think I've been able to explain the whole process of urine formation from glomerular filtration rate of 125 ml per minute, 180 liters, out of which 1.5 liters is urine is collected, and that is collected in the bladder, and how right up to 400 and 500 it is retained. When it goes beyond that, system has to take care and expel it out one by one. It can't expand beyond a particular level, and we should not go against laws of nature, come what may. And once done, how systematically the whole thing designed with the sensory system, voluntary system, sympathetic system, parasympathetic system, and once you know the understand and you become aware of it, you can take a remedial action even before you come to that particular stage. But when it comes, you can even do wonders if it is required, which I do not recommend. But if required, I think you should be prepared that that is also one of the meditations for higher concentration. So having explained that, I think is more than enough to understand what is urine formation, how it is stored, and how it is expelled voluntarily, involuntary, retention, amount, and system, and the sequence. And it's also organic structure of autonomic nervous system, sympathetic system, parasympathetic system, nervous system, sensory, motor, otherwise, and the structure. I think that's more than enough for everybody to understand this is how the system works. Anyway, it was nice sharing my experience in detail. Thank you very much.